Part of Ascension Healthcare's mission is to provide holistic care which sustains and improves the health of individuals and communities. All patients with a urinary catheter are at increased risk for developing an infection. Our job as healthcare workers is to utilize all tools and evidence necessary to reduce that risk. Proper urinary catheter maintenance plays a crucial role in preventing urinary tract infections caused by urinary catheters. CAUTI stands for a catheter-associated urinary tract infection. Whether or not a urinary tract infection is classified as a CAUTI is based on definitions from the Centers for Disease Control and Prevention, or the CDC. Urinary tract infections, or UTIs, are the fourth most common type of health-care-associated infection. Additionally, UTIs account for more than 12% of infections reported by acute care hospitals. Each day a urinary catheter, sometimes referred to as a Foley, remains, a patient has a 3 to 7% increased risk of acquiring a CAUTI. Complications associated with CAUTI include discomfort to the patient, prolonged hospital stay, and increased cost and mortality. It has been estimated that each year, more than 13,000 deaths are associated with UTIs. Foley maintenance and prevention of CAUTI must remain a priority to all members of the healthcare team, not just the nurse or just the technical colleague. It is a team approach that is necessary to prevent CAUTI. We will now discuss key maintenance elements necessary to prevent CAUTI. It is imperative to maintain a closed urinary catheter system. This consists of a catheter inserted into the urinary bladder and connected via tubing to a drainage bag. The catheter is retained in the bladder by an inflated balloon. Observation of an intact tamper evidence seal ensures that the closed urinary catheter system has been maintained. If the seal is not present or not intact, it is recommended that the catheter system be exchanged. The CDC strongly recommends properly securing indwelling catheters after insertion to prevent movement and urethral traction. At our Ascension sites this is often accomplished with a StatLock. If you need to apply or change the StatLock device, first gather your necessary supplies, which include alcohol preps, skins protectant pads, and the StatLock Foley stabilization device. Then, secure the Foley catheter into the StatLock stabilization device before placing StatLock stabilization device on the skin. With the directional arrow on the retainer facing the tip of the catheter, place the distal end of the Foley catheter into the retainer so that the bifurcation of the catheter, or the Y part, rests against the post in the retainer. The catheter should be placed inside the StatLock stabilization device clamp with the large arm of the catheter, or drainage arm, in the wide channel. The narrow channel should hold the small arm of the catheter, or the balloon arm. Close the lid by placing your fingers under the pad. Use the thumb to press on the grip markers at the far edge, not the center of the clamp. The anterior thigh or the abdomen may be used. For anterior thigh placement, place StatLock registered Foley stabilization device on the anterior thigh leaving only 1 inch of slack. With leg fully extended and toes pointed up and not externally rotated, gently lay the StatLock registered Foley stabilization device straight down the front of the thigh. Back the StatLock registered stabilization device up 1 inch toward the insertion site to allow for the appropriate amount of slack. When securing to the anterior thigh, the leg must be fully extended so that undue traction is not applied to the catheter after it is secured. The abdomen is recommended for chronic Foley use in bedridden male patients to prevent the downward pressure that often leads to meatal erosion. Place StatLock Foley stabilization device on the right or left side of the abdomen with the same 1 inch of slack. Once the site is identified, gently place the StatLock Foley stabilization device off to the side. Cleanse and degrease the stabilization site using 3 to 4 alcohol pads to remove oils, lotions and secretions from the skin. Remember to cover an area much larger than the actual targeted stabilization site. Allow alcohol to dry completely. Apply skin protectant pads to the targeted stabilization site. Use both pads and apply skin protectant in the direction of hair growth. Go in one direction only using a painting method to create a smooth surface. Be sure to cover a much larger area than the actual targeted stabilization site. Allow skin protectant to dry completely for approximately 10 to 15 seconds until the skin is smooth to the touch. Please note, if the patient has excessive body hair at the targeted stabilization site, do not shave it, this may cause microabrasions. Clipping the hair is the preferred option when necessary. The StatLock device should be monitored daily and changed at least every 7 days or when soiled. You may wash the StatLock pad with soap and water if soiled, but do not use alcohol or prepackaged bathing systems as they could lead to early lifting of the device. When bathing or showering a patient with a StatLock, cover the device with plastic wrap or a waterproof dressing. The StatLock device is not intended for diaphoretic or non-adherent skin. Clinical judgment about the removal of the StatLock stabilization device should be used if the patient experiences any shift in fluid that may interfere with skin integrity. It is important to maintain an unobstructed urine flow. Dependent loops or kinks in the urinary catheter system can create airlocks that impede urine flow and can lead to increased risk for infection. Preventing kinks and dependent loops can be accomplished by arranging the tubing in a straight-line fashion, positioning the tubing over the patient's leg, and using sheet clips to secure the tubing to the sheet. The drainage of urine is totally dependent on gravity. Therefore, tubing and the drainage bag, to collect urine, must always be below the level of the bladder. This is especially important to keep in mind when the patient is being transported on a gurney, during ambulation, and when using a wheelchair. If the bag is not kept below the bladder, retrograde flow can occur, which may cause discomfort for the patient and increase the risk of contamination of the collection system. The drainage bag should be positioned in such a way as to avoid patient contact. Never hang the drainage bag from the side bedrail, or place it on the patient's abdomen, garbage, or floor. The orange stickers are utilized to keep the date of insertion visible. An orange sticker should be clearly labeled and visible on the front of the Foley bag, the front of the chart, and is optional for the graduated cylinder. The graduated cylinder used for emptying urine should not be used for any other purpose. Foley care should be completed twice daily and as a separate procedure from the bath. Refusal of Foley care should be highly discouraged. Please consult the physician or management if the patient is refusing Foley care. To begin Foley catheter care, supplies that should be gathered include a garbage can, Chuck's pad, clean gloves, 5 disposable wipes, and foam cleanser. Perform hand hygiene and don clean gloves if you have not already done so. Place a pad or Chucks under the patient's hips. Have the patient open up their legs. Take 5 disposable wipes and place on the pad between the patient's legs. Dispense 1 pump of foaming cleanser on each of the 5 wipes. As a note, the Foley catheter can remain secured to the patient throughout this procedure. For females, with your first wipe you should start at the me-addle junction and gently cleanse the first 1 to 2 inches of the Foley or Foley first with your non-dominant hand while cleaning the remainder of the catheter to the bifurcation. Use your second wipe to clean the meatus and distal labia, or side away from you. The third wipe is used to clean the proximal labia, or the side toward you. The fourth wipe cleans the inner thigh away from you in a downward motion. The fifth wipe is used to clean the inner thigh toward you in a downward motion. Discard wipes into the garbage receptacle after each wipe. For males, with your first wipe and starting at the medial junction, gently cleanse the first 1 to 2 inches of the Foley, then stabilize Foley with your non-dominant hand while cleaning the remainder of the catheter to the bifurcation. With your second wipe, clean the meatus and glands. Use your third wipe to clean the shaft and scrotum. The fourth wipe is used to clean the inner thigh away from you using a downward motion. The fifth wipe is used to clean the inner thigh toward you using a downward motion. The Ascension, Wisconsin urinary catheter policy mirrors the CDC guidelines for proper indications for a Foley. Patients who do not have a urinary catheter present are not at such an increased risk for UTIs, and would not meet criteria of the CAUTI definition. Utilizing male and female external catheters to remove Foleys as soon as possible should be considered. If you feel your patient no longer requires a Foley, please be an advocate for your patient and discuss it with the doctor or provider. The manager, nurse lead, clinical nurse lead, or even the infection preventionist may also be consulted. The following is a short video displaying and narrating correct Foley maintenance care.
To begin Foley catheter care, supplies that should be gathered include a garbage can, Chuck's pad, clean gloves, 5 disposable wipes, and the foam cleanser. Perform hand hygiene. If you haven't already, perform hand hygiene and don clean gloves. Have the patient open up their legs. Take 5 disposable wipes and place on the pad between the patient's legs. Dispense 1 pump of foaming cleanser on each of the 5 wipes. As a note, the Foley catheter can remain secured to the patient throughout this procedure. For females, with your first wipe, you should start at the meatal junction and gently cleanse the first 1 to 2 inches of the Foley. Foley first with your non-dominant hand while cleaning the remainder of the catheter to the bifurcation. Use your second wipe to clean the meatus and distal labia or side away from you. The third wipe is used to clean the proximal labia, the side toward you. The fourth wipe cleans the inner thigh away from you in a downward motion. The fifth wipe is used to clean the inner thigh toward you in a downward motion. Discard the wipes into the garbage receptacle after each wipe. For males, with your first wipe and starting at the meatal junction, gently cleanse the first 1 to 2 inches of the Foley, then stabilize the Foley with your non-dominant hand while cleaning the remainder of the catheter to the bifurcation. With your second wipe, clean the meatus and the glands. Use your third wipe to cleanse the shaft. The fourth wipe is used to clean the inner thigh away from you in a downward motion. The fifth wipe is used to clean the inner thigh toward you in a downward motion. Your Foley insertion and subsequent Foley care is officially complete.